last 7 months as interim dean of the U of L School of Medicine, I've been honored to be part of an institution that is committed to educating the next generation of physicians and scientists, developing groundbreaking research, advancing the future healthcare, and making positive impact on the health and well-being of our community, our commonwealth, and our world. For my first major school-wide address as interim dean, I am excited to reflect on some of the achievements of our faculty, staff, and learners, and provide some insight on what we can look forward to in this academic year and beyond. First, I want to recognize those selected for the School of Medicine's Dean's Excellence Awards. These are faculty and staff who were selected by their colleagues for their outstanding contributions to teaching, research, and service to the School of Medicine. We thank you all. The School of Medicine takes great pride in the outstanding contributions of its faculty and staff, and these awards aim to acknowledge your hard work and dedication. Thank you. I would like to give special recognition to our faculty that have accepted new leadership positions at the beginning of this year. Dr. Michelle Stevenson, our new Vice Dean of Faculty Affairs, Dr. Harry Baudelaire, our new Interim Chair for the Department of Microbiology and Immunology, and Dr. Adriana Pilati, our new Interim Chair for the Department of Neurology. In addition, I would like to thank Drs. Carrie Rimmel and Dr. Nijaz Eaglemez for their many years of service to the School of Medicine. And I'd like to congratulate Dr. John Klein for assuming the role of interim EVPRI for the university, and Dr. Christopher States and Amanda Jo LeBlanc for stepping into the roles of interim Vice Dean for Research and interim Associate Dean for Research at the School of Medicine. And to our exceptional learners, I would like to recognize Zoa Mian for receiving a Rotary Global Grant Scholarship to attend the London School of Hygiene and Tropical Medicine. Sarah Downs and Ankita Nair, both U of L medical students recently crowned in the 2024 Kentucky Derby Princess Royal Court. And Sarah Belcher, a rising junior in the School of Medicine and the guaranteed entrance to medical school student for receiving the Fulbright US-UK Summer Institute Award. I know there are many other exceptional achievements of our students, residents, fellow, faculty, and the staff that have occurred. And if I've left any of you out, it's been totally unintentional. And I thank you all and applaud you all. I also want you to tell me when good things happen. So when recognition comes to you, your unit, division, department, center and institute, or administrative office, let me hear about it so I can let others know about it. As I reflect on 2023 and early 2024, I am proud of the many accomplishments we have made, and there are many. In the areas of education, research, and impact to our community, we have made great strides to secure necessary support and funding to continue the incredible work of our faculty and staff. Some examples of these accomplishments include the following: a $16 million HRSA grant for urban and rural undergraduate medical education with a focus on addressing the primary care physician shortage in our state. This grant will provide increased access for care of thousands of families living in rural Kentucky and underserved areas of metropolitan Louisville, and ensure a pathway to medicine for physicians in training, further amplifying our ambition of health equity. We secured an individual gift of $500,000 to increase the pathway to career in medicine by providing support for medical education of students in Louisville from medically underserved populations. We were awarded the Anthem Rural Health Medicine Scholarship Program's gift of $500,000 to increase access to care and improve health equity in Kentucky's rural areas by supporting the medical education for up to 4 students at the School of Medicine's award-winning Trover Rural Campus. We increased our federal funding through several new R01 grants from the NIH that will prioritize discovery in clinical and translational research, including cancer, neurosciences, cardiac care, and environmental health. We also submitted many more R grants, as well as program and program renewal grants from the federal government that will help amplify our funding in science, research, and translational medicine. And we increased our MD and PhD program from 2 students per year to 4 per year in 2024, with the ambition of increasing it to 6 per year in 2025. This programmatic growth in educating our physician scientists will prepare the institution for an NIH MST grant. This type of grant is an application through the Idea Straight program of the NIH. This incredible opportunity will enhance our development of clinician scientists who will advance new treatment paradigms for patients in the Commonwealth, nation, and world. We are committed to fostering a culture of excellence, collaboration, and innovation within our esteemed institution. Our students, researchers, staff, and faculty are the heart of the School of Medicine. It is the commitment and the dedication that the members of our school possess that continue to push the efforts forward in cultivating distinction in the fields of medical education, research, and service. To further the contribution made by our members, it is important to provide a strong and aligned infrastructure. In 2023, we began several initiatives that will provide sustainability for our school and our efforts in teaching, research, and service. For example, we recruited Dr. Brittany Rife McGallis to join Drs. Melissa Stevenson and Corey Watson in the Department of Biochemistry and Molecular Genetics to amplify our immunogenomics core. This expansion is consistent with our identified need to grow our research enterprise through significant cores that relate to cancer, cardiac disease, pediatrics, neurosciences, environmental health, and GI and metabolism. We are striving for further additions to our bioinformatics capability and cohesiveness, including enhanced work with our School of Public Health. To foster interdisciplinary collaboration and create pathways to success for the learners within the university's professional schools, we have convened an ongoing interaction between all 4 HSC schools and formal dean's meetings and meetings with the provost. These intentional leadership meetings ensure that we are making our campus a safe and effective and welcoming place to work, visit, and that we are enhancing interdisciplinary activity and elevating support resources that reach all of our HSC schools. This includes exciting representation involvement with LUMED, the Louisville Medical and Education District, involving planning, safety, and aesthetics of our 22-block area in downtown Louisville. To support President Schatzel's call for greater systemness, including initiatives and long-term synergies within our U of L framework, we initiated, organized, and chaired a strategic alignment project between the School of Medicine and U of L Healthcare and the University of Louisville at large, with consultants from FTI, a leading academic healthcare consultant that has worked with medical schools such as Washington University in St. Louis and the University of Michigan. Competing globally requires a unique medical campus with learning opportunities for all stages of the physician journey. And this project will provide a tangible strategy for a more unified academic medical system, amplifying our strengths and innovating with the new clinical, teaching, and research programs. Historical Black colleges and universities, or HBCUs, are receiving record numbers of applications and now have students applying to medical school, illustrating that the desire to enter the medical field is high for those from underrepresented populations. Through a HBCU engagement among regional HBCUs, including Simmons College of Louisville and Kentucky State University, as well as others, We are working to fill the placement gap for all who wish to pursue a career in medicine, with the ambitious goal of reducing health disparities and building trust in all of our communities. We are amplifying our efforts in rural America by celebrating the 20th birthday of the Trover campus in Madisonville, Kentucky, initiating efforts in Murray, Paducah, and Owensboro to establish rural programs in medicine and primary care in the western part of Kentucky that are already producing physicians so badly needed in rural Kentucky, and expanding that effort to improve the workforce while also bringing our educational and research engines to help improve those communities as well. We have created an artificial intelligence task force in conjunction with the School of Medicine Faculty Forum to provide insight and guidance on the future state of AI in the school and design a plan to integrate AI within the university-wide structures and strategy surrounding the artificial intelligence in the medical teaching environment. I am grateful to the leadership of Dr. Sohail Contractor, Chair of the Department of Radiology, who has great expertise and experience in this area to help the School of Medicine, the health system, and indeed the university regarding our best use of AI, as well as developing appropriate policies and guidelines around the use of AI. In collaboration with other key faculty, we completed and submitted a multi-million-dollar CTRD grant through the NIH Idea State program for the School of Medicine in conjunction with the university and U of L Health. If awarded, this grant will allow us to establish a state-of-the-art clinical and translational research unit that amplifies and creates new efficiencies for research between the HSC and U of L Healthcare. It will provide badly needed administrative and support mechanisms for our bench to bedside research programs. And most importantly, it will connect our clinical and translational research programs to the broader network of our urban, underserved, and rural underserved communities. For more than 185 years, the University of Louisville School of Medicine has led the charge in advancing medical knowledge through distinctive education, transformative research, and extraordinary patient care. U of L Health, our companion partner, is celebrating its 200th year. As we look into the future to a constantly changing and evolving medical environment, I am passionate about the School of Medicine continuing to inspire medical advancement. To become the next generation academic medical campus, a learning and growing educational, research, and clinical enterprise. Much of the work to advance the school's reputation and footprint has already taken place and will continue to weave itself as though a tapestry throughout the year with the input of many of you. Today, I want to highlight 4 key areas that will be especially impactful for our school throughout the next year. The first is research and innovation. As an R1 community engaged institution, these aspects are key to our long-term success, and I have been hard at work laying the foundation for next generation solutions, including the following. Engaged with the state and the Commonwealth of Kentucky in a $280 million ask for a School of Medicine and university efforts around a collaboration hub. This new structure, which would be the first new structure in 15 years on the health science campus, will both bolster learning, research, and community engagement. We need the amplification of research training programs and learning opportunities for pre-matriculation students in an inclusive manner. And with the WIN CIPP program, the Summer Scholars Research Program, and other funded research programs, we are bringing pre-medical and other young scientists to our campus in greater numbers than ever, with a passion for careers in healthcare and science. Third, but possibly the most important, is learner success. Without it, An academic campus is just a collection of bricks and mortar. We are envisioning what programs and services look like along the learning continuum, including providing support services for all learners, working in concert with the university on establishing an overall wellness program for the university, including the HSC, and searching for a chief wellness officer through the university that will integrate with efforts on all campuses. Expanding career and learning tracks and certificate and graduate programs for all residencies in clinical leadership, medical education, advocacy, and research. Finally is community engagement, one of our most prized areas of work. As community engaged university, it is critical that we maintain our dedication to making lasting impact for our campus and community members at large. To that end, we are moving forward with key partnerships, including conversations with Murray State University on potential plans for a U of L medical school campus at Murray. This will increase our medical enrollment and create new opportunities for up-and-coming physicians who have a passion for rural and small-town healthcare. This additional medical school campus is both critical and ambitious. We will develop a capital campaign in collaboration with the Office of Advancement for the School of Medicine in conjunction with upcoming University Capital Campaign. And this will help amplify our mission in learning, care, research, and innovation. And we're already beginning to do that, especially through energized work with our medical school alumni base. We are prioritizing quality, safety, patient satisfaction, and optimal ratings for the School of Medicine and U of L Healthcare, including clinical, educational, and research ranking systems, and our pediatric partnership with Norton Healthcare to assure we are meeting mission, attracting talent, retaining talent, and assuming a significant regional and national role as an academic health center. We are seeking health promotion in the community for cancer, cardiovascular health, digestive health and nutrition, and many other areas through longstanding partnerships like the Student and Community Clinic in conjunction with Our Redeemer Lutheran Church in the West End of Louisville, and collaborative efforts with the Kentucky Cancer Program, Gilda's Club, the American Cancer Society, the American Heart Association, the National Parkinson's Disease Association, Volunteers of America, Dare to Care, and many, many others. And last but not least is the continued and amplified partnerships with the Greater Louisville Medical Society and Falls City Medical Society to improve our community's health, develop scholarship programs to reduce medical school debt, and provide experiential learning opportunities for many of our medical students and aspiring medical students in a diverse set of communities. This journey as the interim dean of the School of Medicine and vice president for academic medical affairs has been remarkable and indeed a great privilege for me. Learning what makes our institution great and preserving these attributes while also understanding the importance of improvement through collaboration, alignment, and innovation have been some of the most valuable lessons during my time in this position. I look forward to my continued time serving on your behalf as interim dean of the School of Medicine and observing the many achievements of our dedicated learners, amazing staff, and leaders and scientists. Thank you.
So at this time, we'd like to open it up. If you have questions, you can post them in the Q&A portion of the section, and we can field any of your questions you may have.
If I'm looking to the side, I'm reading the Q&A. Bring it over here. Quiet group today. Another historical moment, while people are having a chance to think about a question, perhaps, is our U of L Hospital South opened in Bullitt County today, the first hospital in that county, and we're really excited to announce that. I had the great privilege of sitting next to Miss Anna Robinson, who was born on that property 93 years ago today, and her family had donated the property for the development of the hospital. So that community is so excited to have part of the academic health center join the Bullitt County community. So that was a fun thing to do today. Jennifer Ham asked, can I speak more about the Chief Wellness Officer? Jennifer, thank you for your question. And we're working with the university and the president's office and Dean Michael Martis in student affairs of the overall university to develop a platform for wellness that really extends not only on the Belknap or undergraduate campus, but extends to the HSC and all other campuses. What that structure will ultimately look like is still a product and evolution, but I can tell you that I'm really excited that we have a much greater institutional commitment to wellness, and I'm certainly very deeply vested in making sure that the health sciences campus can take advantage of that. And when we think of wellness, I'm thinking very ecumenically of our student population, our faculty, and our staff, because we need wellness for all those communities to operate optimally. And we do a lot of the elements of what I think are wellness now, including wraparound services for our students and community, but we can always do a better job of that. And by elevating this up to a chief wellness officer and office for wellness, I think that is a great thing because it's going to provide opportunity to amplify those efforts. Okay, I'm picking through some new posts here as long as we have time. It says, could you describe the functions of the proposed building? Has a needs assessment been conducted? So we have some global concepts about that with regards to expanding laboratory space, expand conferencing space, expanding a really state-of-the-art simulation space. But in terms of the final plans and the final constituents of the building, that's still to be determined. But we definitely will be doing that through a needs assessment and a formalized planning process. And we'll try to make that as absolutely transparent as possible and involve the community in the development of that building. But I'm really excited about it because I think it will amplify our ability to do transdisciplinary, interdisciplinary education, collaboration, innovation, and develop new partnerships that will really make us a bigger and broader part of the university. Dr. Kidd, Lucrease Kidd asked, are you applying for the permanent dean's position? I am applying for the position. That process is being run through the provost office of the university, and I am submitting an application, and thank you for asking. Additionally, it says, as a standardized patient with over 12 years at U of L, I'm hopeful that we will be upgraded from an employee level with partial benefits. Is that a possibility? You know, many of the things that get asked are areas that I need to be educated more on and learn about it. So I really appreciate the anonymous question here. I definitely would be interested in learning more about this and learning more about that detail. And I would encourage you to email me so I can learn perspectives, and I will work thoughtfully. I'm deeply interested in making sure all of our employees feel that they're treated fairly, and always making sure that they have a voice, and making every effort I can to make the conditions at the University of Louisville really coherent with our strategic plan of making U of L a great place to work. So I thank you for your question.
Dean Bumpous, I'll read the questions out because we got a couple coming in now. I don't want you to get lost in them. So,
okay.
How about could you describe the functions of the proposed building, and has a needs assessment been conducted?
I hit that one a little bit. No formal needs assessment. We are looking at a simulation center, classrooms, laboratory, landing space and dining space, and a lot of collaborative spaces. But the final footprint hasn't been made, but we'll definitely make that a transparent process as we undertake that. We're still in the budget, so we're hopeful to keep that. But as you are all aware, we're still in legislative session in Frankfort, so we're keeping our finger on the pulse of that effort. But thus far, we're looking pretty good. We're hoping for this to happen, and if it does, it'll be a big celebration for us.
All right, next question. I would love to hear more about the CTRD grants. Is the application available for viewing by chance?
I would encourage those who have an interest in the CTRD grant to talk with Dr. Chris States and with Dr. John Klein's office. It is available. We are definitely working on it. We had great participation in the grant, probably amongst the broadest participation of all our research committees and research components of the medical school. As most of you know, about 75% of the research done at the university is done in the School of Medicine. But we included people from the School of Public Health, the School of Engineering, and the School of Medicine to really look at this in a very holistic way. So it's an excellent application, but definitely Dr. States and Dr. Klein could provide details as needed.
All right, this just came in. Projections predict an enrollment cliff for undergraduate students in 2025. Does AAMC or other medical organizations see a decline in number or quality of medical student applications in 2029 or later?
You know, I think this is it's a great question and a very complex problem. Yeah, thankfully, on the undergraduate campus of the U of L, we are really counter to the trends. We've experienced 2 years of increased enrollment, but a lot of that has been intentional through the border program to lower tuition for adjacent counties in Indiana and even Ohio and Tennessee for attendance to the University of Louisville as an undergraduate. So thus far, we have intentionally done some things that have made us less susceptible to the undergraduate enrollment cliff, as they refer to it. In terms of applications to medical school, obviously, when things affect undergraduate campuses, there's a wave that comes that will eventually affect the professional schools. We are certainly aware of that. I can tell you, at least in this year, we have over 6,000 applications for medical school, and we've been able to secure an outstanding class with excellent attributes academically in that process. So I think we are maintaining that at this point. It is a broader term of discussion and research that's being conducted through the AAMC. I think we have to keep our finger on the pulse of that. I additionally think that because of the pandemic, we have to really think very seriously about support services for all students and providing appropriate ability to have wraparound services, not only for physical and psychosocial support of our students, but for educational support. And not only on our undergraduate campuses, most definitely in our HSC and in our professional programs and in our graduate programs. So we're intentionally thinking about that and working in that direction with great emphasis and great vigor. In fact, with the HRSA grant that I mentioned earlier, we are adding support services around student advising and around student support with tutoring. So those are recent additions that we hope will help our student population.
All right, as of now, there are no more new questions. We can give another minute. Actually, hold on, new post just came in. Can you provide some information about the recent residency match results? How did our medical students do in the match, and how did our training programs do in their match?
Training programs did quite well, at least preliminary reports that are out that we're still getting some final details. After the SOAP process, we have over 97% of our students matched. That is in keeping and actually in excess of national statistics. Our residency programs have done quite well in the match as well. So we're looking at good numbers, and we'll post the final numbers on that soon after we've worked with both the UME and GME offices. But the initial numbers look quite high and quite good.
All right. It says you have been a long-term engaged participant with U of L and VA healthcare. What has been one of the most rewarding student member and training experiences going from a sideline view to being interim dean? i.e., can we improve more integrative efforts with VA physicians training our residents?
I think that's really important. And I think, experiential learning is at the heart of teaching physicians. And that can be from pre-matriculation at students having shadowing experiences. We need to be really much better at offering those students opportunities to shadow, learn about us, and have the experience of being in a healthcare environment. Likewise, medical students need experiential learning, and the VA hospital is a prime area of that, with a group of patients that are dear to us. I myself grew up in a military family where my dad was a 30-year veteran. My brother is a 22-year veteran of the United States Air Force. So our military and the people who've served in our military are dear to me. I was able to serve at the VA for almost 30 years. And that was part of the reason I wanted to be at the VA, was because of the history of my family. The VA also still represents a very strong training environment that gives an opportunity for independent learning experience. It also gives an opportunity to deal with adult issues and geriatric issues. That is a very important training environment. We need experiential learning. The VA is a huge part of that. So I want to continue that and continue to strengthen our relationship with the Robley Rex VA here in VISN 9.
All right, thanks to Dr. Lacrease Kidd. She actually posted a response to the residency match with a link to an article. And then she actually followed up with the question, was this meeting recorded? Yes, we did record this. It's still currently being recorded. And Tanya Augustine mentioned we're going to post this in next month's faculty staff newsletter. So it'll get out there for all the masses to rewatch this as they need.
Thank you, Glenn. Appreciate that. And we do want to hear from you. We really, if there are accomplishments going on in your unit, I'm so grateful to have Tanya Shive Augustine as our major communications officer for the school. And Tanya and her staff are really committed to telling our story. And you guys have some great stories. And those stories need to be amplified. And our public needs to hear them. Our students need to hear them. Our potential students need to hear them. So please send your stories to me.
All right, so far, no new questions. We can give it maybe one more minute for any new questions to pop in. All right, just a new comment from Dr. Kidd. So yeah, I think you're free to close out if you'd like to.
Let me make just a little concluding comment. First of all, I just want to thank you all very much for sharing part of your afternoon with me. The reason we did this virtually is so you guys wouldn't have to move too far from your busy day jobs in accomplishing the many things you do for our school. The one thing I have to say is I come to this meeting with great humility and absolute gratitude for the many things that our students, our faculty, and our staff do every day to make this a wonderful place that's having impact. Always know that this job has enduring and great impact, and your dedication to it is greatly appreciated.
Everyone, we'll go ahead and close off and end the Dean's Address. We thank you for attending and look for the recording in our monthly faculty staff newsletter that goes out to everyone from the School of Medicine.
Thanks. Have a good afternoon.